been a lot happening today, and I appreciate you taking the time to hear from our physicians, and I want to thank them as well. They certainly have very, very full schedules, but we felt it was important to take this time today to just kind of give you some insight as to what's happening specifically within our health system. I will tell you that we're waiting on Dr. Gibson. He had a little scheduling issue, but I know he'll join us as soon as he can. So we'll put his introduction and opening comments towards the end. But like I had said in my communication, what we want to do is just allow each of these physicians to, after introductions, provide just kind of an opening statement, give a brief overview of what they're seeing, experiencing at their various facilities, and then we will open it up to questions. We want you guys to just ask as you wish. If you do have questions or you'd rather put something in the chat, we'll be monitoring that as well. But we want this to be an open conversation and provide you with as much information as we can. I do want to be cognizant of time just from these physicians' perspective, but we also want to make sure you guys have ample opportunity to answer the questions that you may have with regard to what's happening within the health system. So I'm going to go off audio, and we're going to get started with Dr. Sumit Mukherjee, who's a pulmonologist with Methodist, and he is also director of our critical care unit at Methodist Jennie Edmundson Hospital. Dr. Mukherjee.
Well, thank you for the time. I appreciate the opportunity to speak. So, I wanted to start by talking a little bit about what we're going through here, both in our hospital and the hospital system as well, and really throughout the community. 1 year ago, I remember going through a process of understanding what was happening with COVID and trying to just kind of get through it with at least some hope, I think, with the possibility for, as vaccinations were coming along and the possibility of things settling down a little bit. And here we are coming into 2022. And I know right before the new year was one of the worst days I've had personally as a pulmonary critical care physician, putting several people with COVID on the ventilator, taking patients and essentially, unfortunately pronouncing several people dead from COVID, moving them out of the ICU, and then turning the room around and putting people back on the ventilator with COVID. And that has been a process that just has kept going, and we are exhausted. This has been such a terrible journey, and although we did have a break in some numbers, we are now faced with increasing numbers, but now, in addition, the challenges that we're facing with the bedding situation in our surrounding area. For example, in Southwest Iowa, I'm getting calls every day from physicians who are in smaller critical access hospitals in Southwest Iowa who are asking if we can get patients, anything to get a patient through. Can you help us? We have this patient not doing well, COVID positive, respiratory failure. We can't handle their level of acuity here, their needs here. Can you get them in? And there are no beds. And the staffing issues have been a challenge for everybody in the region. I think every hospital is different in terms of those staffing issues and challenges, but it's been across the board. Everybody's been having these issues with staffing, and you can see it on our staff, on the faces of our staff, our nurses, our respiratory therapists, our nursing aides. They are worn, and we're doing all of this now feeling a little bit of hopelessness and feeling like sometimes we don't quite have the support from the general public as well, because there is obviously a lot of discussion in the community about whether or not the hospitals are really struggling or not, and whether or not COVID is really happening or not, and are these hospitalizations really COVID, or are these patients, sick from something else, or are they really having difficulties from their other comorbid conditions, or of these various questions, are they vaccinated or unvaccinated? And I think the message is important here. I think the message that the majority of the patients that we are seeing in the hospital still at this point during the surge are unvaccinated. And we are having a crisis. We don't have the beds. We don't have the beds to be able to take care of people with COVID. We don't have the beds to be able to take care of those people who need care otherwise, who are sick with other things. And it is certainly at the point where we are struggling for various reasons, in addition to really feeling pretty run down and feeling like we, if we don't come together as a community and get through this together, that we are going to be dealing with this forever.
Very good. Thank you, Dr. Mukherjee. Dr. Emily Patel, we'll have you go next. Dr. Patel is a maternal-fetal medicine specialist, and she is based at our Methodist Women's Hospital campus. Dr. Patel.
Hi, thank you for having me. So I am one of the high-risk obstetricians that works at Methodist Women's Hospital. So I specifically am taking care of our pregnant population in general. And then as far as COVID goes during this pandemic, our maternal fetal medicine, our high-risk specialists have been kind of the front line in helping to triage patients with COVID, care for them while they're in the hospital, along with our infectious disease and pulmonary colleagues, pulmonary critical care colleagues. And so we have really kind of seen the whole gamut as it pertains to pregnancy and COVID. And what I can say, kind of an update about what's going on right now and what I'm seeing right now. We have the highest numbers of COVID positive pregnant women than we've seen in the entire pandemic right now. And that goes along with this Omicron variant, which we know is highly communicable. Fortunately, there have been less severe outcomes, but at the same time, when we're seeing so many more cases, we're still seeing bad outcomes because of it, because we just have so many more cases. And so the things that we're seeing that I can tell people about, we are delivering moms prematurely because of severe COVID, worsening respiratory status and concern for fetal status because of that. So we're delivering babies prematurely, and putting babies, unfortunately, in the neonatal ICU for that reason. We have seen stillbirths. We know that this is a risk, and there is a publication through the CDC about the risk of stillbirth. During the Delta variant, that risk went up fourfold for stillbirth, from about 6 in 1,000 to about 27 in 1,000. So very dramatic increased risk of stillbirth. And we unfortunately have seen that in our hospital and throughout the state. There have been maternal deaths in our state because of this. And then we're also seeing things like increasing risk of illness related to the placenta. So we see things like high blood pressure or preeclampsia as a result of COVID illness and pregnancy. So these are all things that we are seeing right now as we speak, but they've been increasing slowly over the course of the last couple of months. I want people to know that we unfortunately have limited resources right now, as Dr. Mukherjee already mentioned, that we have to prioritize to the highest tier of patient in terms of the treatments that are available outpatient because of supply. And we're hoping that that will change. But right now that's where we're at. And so the best advice that I can give and the best protection that we can get for our pregnant women is vaccination. So I'm really advocating for that, obviously for our pregnant women, but also for the community. And then just taking as many steps as possible to mitigate risk by things like wearing a mask in public and that kind of thing. So those are some of the things that I've been seeing, and a brief message about what I wanted to get across today.
Thank you, Dr. Patel. We'll go to Dr. Michele Williams. She is the medical director of our emergency department at Methodist Fremont Health. Dr. Williams.
Okay, hi everybody. Thanks for coming today to listen to our message. I think the best way I can kind of tell you about what's going on in our emergency department in Fremont and really emergency departments across the country is to tell you about my day yesterday. So when I came on for my shift at 6 a.m. yesterday, we had 7 patients in the emergency department that were essentially inpatients. They are all waiting to go to a bed in a hospital somewhere. And we don't have any beds in any hospitals anywhere. So some of these patients are COVID patients, and some of these patients are other patients that have other needs that need to be in the hospital. And instead of getting them to our hospital, if we can take care of them at our hospital, or a higher level of care hospital if they need a service that we don't have, they are sitting in an emergency department waiting for care. And so this is complicated for our nurses who are already short-staffed trying to take care of inpatients, which is not their specialty. It's complicated for our hospitalists who are coming down from the floor to help us take care of these inpatients that are in the emergency department. And then it's complicated for our patients who are continuing to come into the emergency room in need of emergency care. And instead of 12 beds, we now have only 5 beds to take care of all of those patients because we're housing the inpatients. We have a 12-bed emergency department. This is happening on an even bigger scale in the larger emergency departments. This is the crisis of care that we're having because our hospitals are full. They're full of COVID patients. They're full of all the other patients. And we don't have anything to do with these patients. And our hospital is getting calls every day to ask for patients to transfer in, and we don't even have enough beds for our patients. I've been in tears a couple of times trying to find the appropriate care for my patients. And every hospital I'm calling is saying, no, we don't have any room. I can also tell you that although our team of everyone in the hospital is frustrated and tired and stressed, they keep working together. They keep working as a team. And I was amazed yesterday at everyone who came to the emergency department. We had quality nurses coming down and saying, how can I help? And they were sitting with our behavioral health patient that we were holding in the emergency department. And our director of quality came down and bought us all lunch because none of us had time to go and take a lunch break. And we called in extra nurses that came in to help take care of the inpatients so our other nurses could take care of the patients that continue to come and check into the emergency department. So I just want everyone to know that we are doing the best we can and we are taking care of the patients to the best of our ability, but we don't have the ideal resources. We don't have the places to send the patients that we would like to send them. We don't have the beds in our facility that we would like to have. And so we will continue to do that. We will continue to see patients. We're the only hospital in town in Fremont. And so we don't ever close our doors. We don't ever go on diversion. We see everybody that comes to us. And I guess that would be my other message is that everybody's worried about COVID and other respiratory viruses. And there is just a lot going around in our communities that's making people sick. There's COVID, there's influenza, there's RSV. And people are worried and people are looking to get tested or to get vaccinated. And if you are sick, if you are short of breath, if you are having chest pain, if you are dehydrated, if you're having emergencies, please come to the emergency department. We're here. We will take care of you. If you want to know if you have COVID, but you're not sick, there are a lot of other options in the community, and we're trying to help get that message out. The county health departments, the local primary care offices, the local pharmacies all have options to try to get you tested or vaccinated, and you don't need to come to the emergency department for that. So those are my messages.
Great, thank you, Dr. Williams. And coming in short of breath, we have Dr. Matthew Gibson, who is a pediatrician with Methodist Physicians Clinic.
Yeah, thank you. Sorry for the late arrival. I was literally seeing COVID patients. So from a pediatric standpoint, I think I would want to tell everybody, this is by far the most number of COVID cases we've seen in pediatrics over the past 2 years. We're pretty much just being inundated with it like all the other specialties are. And this is kind of across the board from an age range standpoint. We expect kids to be sick in the winter. Unfortunately, every year flu goes around, there's RSV, there's always normal kind of coughs and colds and sniffles. Those are still there, but they're just getting absolutely trampled by the number of COVID cases. I think we are lucky in the sense that most children handle COVID fairly well, where they don't end up needing oxygen or needing to be hospitalized or have inpatient care. But there's still a subset of children who do. And the problem is just a problem of numbers. So when you have this many kids who are this, getting infected, you just like with the adults where the hospitals are getting full and kind of overrun, the same thing's happening with pediatrics. The Academy of Pediatrics just had some data that just in the first week of January alone, there was over 500,000 positive pediatric cases. And those are only the people who are getting tested. So there was 580,000. The biggest thing we can do to help stop it is just like with adults is getting kids vaccinated. 5 and above can be vaccinated now, and the vaccine's safe, it's effective. It's fortunately kind of widely available. And so I absolutely strongly encourage people to go get vaccinated, even though there can be some breakthrough cases of Omicron with having been vaccinated. It keeps you having a typically shorter course, less symptoms, less contagious for as often. And it's going to keep you out of the hospital. For kiddos, it's not that you need a booster. It's for most of the young kids, it's still just 2 doses. So I absolutely encourage people to do that. We are seeing the normal winter stuff, COVID, and that's what everybody is getting kind of checked out for, everybody's worried about. And it's definitely here. I think that on Monday alone, 75% of the tests that I ordered were positive. For one of my partners on Tuesday, it was 90%. I mean, these are just astronomically high positive percentages. And to give people an example, like normally our COVID test is a PCR and it takes about 20 minutes. We're on more than like a 24-hour delay just because of the sheer volume of patients that are getting tested each day. And so I still feel very lucky that we're finding out that quickly. I wish it was 20 minutes. It'd be a lot easier for families. But if anybody's concerned, oh, it doesn't affect kids, it's not here, it absolutely does. And the thing that makes me the most nervous as a pediatrician is we know that the vaccine is safe and that most kids handle this really well right now. What we don't know is what's going to be the impact over the next few weeks and months for people who have some of the late inflammatory reactions, for kids who can get cardiomyopathies from COVID, from the complications that can show up down the line. That's what kind of makes me nervous is, yes, most kids are going to do fine just now, but are we going to be inundated even more with kind of a second wave of complications in a few months or in a few years? That's what kind of makes me concerned now too. So it's not just, sniffles and fever, but it's like, it might look like that right now. And the hope is that's what it stays. But we know for some kids, it's going to be more than that. And if we can avoid any kids from getting sick and being hospitalized or having complications, that's the goal. So stay home if you're sick. Oh, please don't send your kids to school if they got fevers and they're sick. Get them tested. Please go get them vaccinated. And obviously, if there's issues, call us. We're still seeing patients. We still have to see kids. We're going to make sure that they're healthy. They don't have ear infections. There's nothing else that they need. But try to minimize it as much as we can.
Very good. Thank you, Dr. Gibson. We'll now open it up for questions. No rhyme or reason. If we've got somebody who would like to get us started, feel free. We'll also be keeping an eye on the chat so we can take your questions there as well. And we'll ask those accordingly. But if someone wants to get us started, we'll open it up for questions of all the physicians. Anyone want to get us started?
Hi, Peyton Nix with the Fremont Tribune. Can I just give a question to basically all of the physicians that are currently in the chat?
You bet.
Yes, I just want to ask, what can obviously one of the biggest concerns right now is bed availability and hospital capacity. What can the general public do to minimize that as much as humanly possible? And anybody can answer this.
Dr. Mukherjee, you want to go first, and then we can, if others want to chime in, I'll encourage you to do so.
So I think that just to kind of reiterate, one of the things I talked about of what we're seeing, particularly in the ICU, is critical illness. And when patients come in with COVID, it's not it's not a short length of stay. You know, patients come in, there's typically 4 to 5 stages of progression with COVID. They start off feeling fairly well. They are requiring significant amounts of oxygen still, and then that just progresses through the hospitalization, and it is weeks to months. And if they get put on a ventilator, we're talking 6 weeks, 8 weeks in the hospital, then transferred to facilities, which are also backed up. And we're talking about a bottleneck process, essentially. And so I think that when we are seeing the majority of our patient, in fact, every one of my patients, last week who were in the ICU on a ventilator with COVID positivity was unvaccinated. The answer is vaccination. If you can get vaccinated, that is the biggest thing that you can do to help this crisis we are in terms of numbers. Because when you get severe illness, and again, as some of the other physicians mentioned, Dr. Gibson mentioned, when you get vaccination, you can get breakthrough COVID. You can get COVID after getting vaccinated. I think that's important for people to understand. Severe illness, however, is very, very rare after you get COVID. And these people who come into the hospital and stay for weeks, that takes up a bed in the hospital for weeks, and they need it. But it bottlenecks and backs up, and that makes it so that other beds aren't available for other patients.
Thank you, doctor.
Anyone else want to chime in on that?
Dr. Gibbs. So I was just going to reiterate what he said, because we're seeing all different COVID patients come into the emergency department, and we're seeing some patients that are sick, but vaccinated. And we had to tell them, well, you're positive for COVID. And I've had a lot of them ask me, well, why did I get vaccinated? And my answer to all of them is because right now I'm sending you home from the emergency department, and you're going to go home and you're going to be sick for a few days, and then you're going to feel better. And if you weren't vaccinated, there's a good chance that instead I would be admitting you to the hospital, and you'd have a lot higher risk of being stuck in the hospital on a ventilator and maybe never going home. So I just wanted to reiterate that that's exactly the same thing that we're seeing in the emergency department, is that the vaccinated patients, most of them we're sending home, and many of the unvaccinated patients are ending up in the hospital.
Good, thank you. I've got one here for Dr. Patel. They would like to know if you could elaborate a bit more on the maternal deaths that you'd mentioned.
Yeah, sure. And of course, I can't obviously get into any specifics, but so what we know about COVID and pregnancy is that women who are pregnant have worse outcomes as compared to non-pregnant women of the same age and comorbidities. And the numbers are as such. So ICU admission or ventilation, mechanical ventilation, is about a 3-fold increased risk for a pregnant woman. And this is just pregnancy alone, not considering any other comorbidities. And then for risk of death, it's between about 1.7 and 2-fold risk of death as compared to a non-pregnant woman of the same age. So in terms of death, we absolutely know that there's an increased risk for pregnant women. And so we have seen that in Nebraska. It has happened here. And obviously, like I mentioned, I can't get into specifics, but the impact is obviously worldwide. But I think it's important to know that this is happening right here in our community and in our state. And these are otherwise typically young, healthy individuals. Sometimes they have comorbidities too, and that absolutely increases the risk. So things like diabetes or high blood pressure increases that risk even further. So while this isn't happening with a lot of frequency, those absolute numbers are still low. When it happens, it impacts lots of people, families, the children that might be involved, husbands, grandparents, all of that stuff. It's really, and this is happening too for non-pregnant people, obviously. So it's another plea on my end to just say, vaccination is the best way that we can mitigate that risk for pregnant women. The vaccine is safe and effective in pregnancy. It does not cause infertility. It does not cause miscarriage. It does not cause stillbirth. It does not cause fetal anomalies. It is safe and effective. And at this point, as far as the CDC tracking has gone, we are up to about almost 240,000 women that have been followed. And that doesn't include all of them that have been vaccinated, but hundreds of thousands of women that we have data available on that have shown no red flags. So I definitely want to get that message out. So.
Okay, thank you, Dr. Patel. I've got a couple here in the chat, and then I'll open it back up to the group because there's a couple here that are pretty similar. And I'll start with you, Dr. Mukherjee. As we're aware, Nebraska Medicine had announced earlier that they were going to crisis standards of care. So the folks are curious if we are looking at that yet, and what would be that threshold that might result in us transitioning to crisis standards of care.
Sure. Yeah. So, that's something that we are looking at constantly at each individual hospital in our health system. We're looking at the numbers really from an hour-to-hour basis, and there's so many factors that come into play here, including staffing and what our outpatient volumes are like, and what the rest of our inpatient volumes are like. And so these are things that we're considering on an hour-to-hour, day-by-day basis, and we'll continue to do so. At this point, we are not moving forward with that. But we will certainly reevaluate that as time goes on a daily basis.
Great, thank you, Dr. Patel. Questions from the group? I've got one other in chat, but I want to open it back up to the folks here on the line if there's other questions.
Joey Saftik with KTV here. Where are you with elective surgeries right now, and would that factor into enacting crisis standards of care?
Sure, I can take.
Yeah.
Well, so, with elective surgeries at this point within the health system, each hospital is doing things slightly differently, but we've all taken measures to decrease hospitalizations. I think one of the important things to understand is that the patients who are admitted with COVID require telemetry monitoring and beds that have very specific standards. And some of those procedures and surgeries that are done electively don't necessarily require that level of care. So a lot of the bedding issue that we are having is certainly with being able to monitor those patients who require critical care safely with telemetry and ICU beds. And so each hospital, depending on the volumes of both hospitalizations and elective surgeries, are evaluating those independently. But all hospitals across the system have taken measurements to make sure that we have plenty of telemetry beds available for the patients that we need and optimize that.
Thank you, Dr. Mukherjee. Dr. Gibson, have you had any significantly ill kids with COVID at this point?
Yeah, I mean, I think that over the course of the past 2 years, we've had people, and with the big uptick in numbers over the past few weeks, we've seen a rise there. I don't know what the specific numbers have been over at the Children's Hospital, but I know their census has gone up quite a bit. I don't know how close they are to full. We usually get an update kind of each day. But the biggest thing is any child can get sick if you have underlying conditions with asthma, with any developmental delays, really anything that kind of predisposes you to becoming more ill. This hits you quite a bit harder. Similar to the way that influenza might, if we know like, oh, it's really critical for asthmatics to get their flu shot. It's the same process with coronavirus. Again, the nice thing is that, okay, fortunately, there's not nearly the number of mortalities with pediatric cases, but I think that it's important to recognize that mortality is a really poor metric to gauge an illness because all of the complications that come out of it have just as big of an impact. And so when we're looking at I think sometimes people get caught up on death numbers for adults and for pediatrics and for everybody else. And it's like, there's a lot more to that. And it's important to remember that every one of those numbers is a person. And so there's absolutely, I've had patients who have had prolonged hospitalizations for kind of 2 weeks or more. Even it hasn't necessarily been respiratory issues, but hydration issues. When you have a, 2-month-old baby who's breathing really fast, working hard, is all stuffy and gunky and kind of can't breathe appropriately, they can't eat, they can't breastfeed, they can't take bottles, so they get dehydrated. So it may not be that their lungs are having that big of an issue, but they still require hospitalization and require further care to kind of meet their basic needs. And that's across the board from, newborns to toddlers to, elementary school kids and teenagers.
Great, thank you. Other questions from the group? Go ahead, Joey.
Yeah. We've heard from some doctors about compassion fatigue. Have you all been feeling that? And what strategies are you using to go into work every day and make sure that you're giving your patients the care that you signed up to give them?
Dr. Patel, you want to start us on that one, and then we'll go across and let everybody respond to that question.
Yeah, sure. No, that is absolutely, it's real. I would say the thing that is hard as a physician, taking care of people and really trying to do our best to advocate and get accurate information out there is when we're met with a lot of distrust and doubt about what we're saying and what we're recommending. I've obviously dedicated my career to taking care of pregnant women, and my end goal is always going to be a healthy mom and a healthy baby. And I would never recommend anything that was going to be harmful or that I thought was potentially harmful to any of my patients. And so when I take care of their diabetes or their hypertension, or their lupus, and they say, "Yep, doc, I trust you, and I'll take this medication, or I'll do what you say, and that makes sense to me, and yes, I like that plan." But then I bring up the COVID vaccine, and they say, "Oh, I don't trust that. I don't trust you and what you're saying." It can be, it's hard. It's very difficult. And it wears me personally, it wears me down. And I think other physicians too. And what we're trying to convey is that we care, we're trying to get good, accurate information out there. And ultimately we want healthy patients. All of us do. And so in terms to answer your question, what do we do about that? I'm here today for this is kind of the way that I try to get the message out there. I just keep on going, and if I can reach 1 or 2 people by this today, or by a blog that I put out with Methodist or something like that, then it will be worth it in the end. If I can help a couple of people on the back end. So that is what ultimately keeps me going. But yeah, it has been hard, I would say.
Dr. Williams.
I think that the most difficult thing that I'm seeing with my colleagues in the emergency department, and really all the staff in the emergency department, is this is a really different kind of care than what we've been trained to do, than what we've been doing for years, because we are spending a lot of our time taking care of inpatients, which is not something we usually do. And we're spending a lot of time on the phone trying to find places for our patients to go. And at the same time, we're still trying to do all of that care for all of those other patients who are still coming in, who still need our care. That's still the regular thing that we do. And I think that is what is probably weighing on most of us and wearing us out, is that doing so many different jobs and still trying to do our best and to still just give the best care to patients, which is why we're doing what we're doing. I feel that some of the hardest jobs that we have right now is our triage nurses. some of the patients and family members are really giving them a hard time. Like, why are we sitting in the waiting room? Why don't you have a spot for us? Why can't our entire family come back and visit this patient who's in your emergency department? And so what I would ask the general public is to be patient with our healthcare workers. Everyone is really still trying to do our absolute best under circumstances that are not what we're used to and not ideal. And please have some patience, have some compassion for these nurses and staff and doctors who are all trying our best, and we're trying to communicate with you what's going on in the situation that we're in. And we really still care, and that's why we're still there.
Very good. Dr. Gibson?
Yeah, I mean, I think that to kind of echo what's been said already, I think that there is, compassion fatigue, but I think there's just general fatigue. There's all of it, because everything, I feel like COVID has become kind of the big, elephant in the room that kind of crashes and steps on and kind of messes up everything else. So even if somebody's here for just a normal well visit, part of that well visit is spending 5 or 10 minutes extra talking about what do they need to, trying to convince them to get a COVID vaccine, or wondering they need to know what they need to do about these daycare exposures, or when their kids can go back to school because their best friend on soccer was positive. And, it kind of reaches its tentacles everywhere. And I especially think, like, to all of the staff that we have, from our, our nurses, our patient care staff, our receptionists, like I think, by the time people get to me, they've already seen a few other people. And I think they do take a lot of the brunt of it, because people are, again, frustrated about long waits. Well, wait times take longer because more people are sick, and then more people have more questions, and there's more complications. That we want to take the time and address those and provide really good care, but that time has to come from somewhere. And so I think that it's challenging for kind of everybody all along, and that's recognizing it's just as challenging for parents and for kids, because it's like it's been 2 years of this, and everybody's kind of over it, but us being kind of tired and wanting to be past it doesn't make it go past any faster. And I think that's the hardest part, is everybody's kind of stressed across the board. And so trying to remember that we want to kind of show some grace to each other, and some patience for everybody, that I think everybody, and at least I know for Methodist, for my clinic, for my colleagues, like we all have each other's best interest at heart. We want the best for every kid that walks through, every parent that walks through. But we unfortunately can't just do everything exactly like we always have, because things aren't like they've always been. So I give my kids hugs when I get home. That helps me, clean off first. But try to focus and distract on other things when I'm not here. But it's just do what you can.
And Dr. Mukherjee?
Yeah, I would also echo the same sentiments. I would say, as a critical care physician through this pandemic has been quite interesting as a pulmonologist. When I did my training in pulmonology and critical care, I certainly didn't think I'd be facing a pandemic someday. And it has been challenging every step of the way, in different ways, as the pandemic has evolved. So we're used to taking care of patients that are very sick, sad situations, critically ill patients. What we're not used to is dealing with the volume of people that are dying from the same condition. On December 28th, I pronounced a third of our ICU dead from COVID, and then I took again 1/3 and put them on the ventilator, and that was all in a 30-hour period of time. And you are not used to dealing with that kind of volume. And, no matter how you slice it, those types of numbers, depending on whatever hospital that you are practicing in, it will definitely be a strain on the physicians, on the nursing staff, on the respiratory therapists, on the aides, and then you combine all of that with things that the other physicians on this call have mentioned, such as some of the confrontation that we have, and some of the distrust. I think that makes it very difficult, because I'm doing my job no differently than I've done it in the years I've practiced medicine. I'm still trying to help people. I'm still trying to save people's lives when they're in the intensive care unit by putting them on ventilators. You know, that look in somebody's eyes before they go on a ventilator does not change. Doesn't change if you're vaccinated or unvaccinated. Doesn't change if you're 80 and have comorbid conditions or if you're 20 and don't. It is something that none of us like to see. We still have, it still hurts us, and we feel such compassion for what everybody is going through, and it's tragic. And we really just want people to come together and understand that we're fighting the same battle here. And I think that is something that has been a challenge for me every day through this pandemic, particularly in the last several months.
Okay. Are there any other questions? I want to be cognizant of time. I know we've taken a lot of these physicians' time, but any other questions at this point? I do appreciate the media who joined us today. I know we've asked a lot of your time too, but I think this was an important conversation and a good perspective on what's happening here with us. And we appreciate you sharing our message here today. If everybody's got just a couple more minutes, I was just going to have each of the physicians just give a closing comment, and then we can wrap this up. But I just, before we go, I want to thank everybody for being with us today and appreciate you getting the word out for us. And we'll start back with Dr. Patel.
Yeah, thank you for having me on today. I mean, again, my main goal is to get this information out to the general public, obviously to our pregnant patients or people considering pregnancy as well. Biggest message I can send today is please consider getting vaccinated if you have not. We have some really great resources through Methodist that we've put together to explain a little bit about the vaccine, the efficacy of it, why we think it's safe, and how it can help you. So please, feel free to get that information, read it, make an informed decision with good information. A shout out to all my colleagues here at Women's Hospital and all the people that are working out here to keep this hospital safe and running effectively. And, ultimately, we're here to take care of anybody who walks through the door, and we will continue to do that. And, please just help us out and do your part as well as much as possible. We appreciate it.
Williams?
I want to thank everybody for coming today and listening to our message. I think you'll probably hear this from all of us, but I'll say it for my part too. What we're seeing in the difference between unvaccinated patients and vaccinated patients is real. We're seeing it in our very own communities. And so I ask you to please consider getting vaccinated if you're not. We are seeing it make a difference. I also ask you to please do come to the emergency department if you're sick, if you're having an emergency. We are still there. We still care. We want to take care of you. We want to help people, and we are making it work. And I want to ask you to not come to the emergency department if you're not sick. And Methodist has other resources. Our communities have other resources for helping you to find testing, to find vaccinations, to find answers to your questions. And I do want to just thank Methodist and our teams in Fremont for all of the support that we're getting. I'm amazed with all of the fatigue and the stress that everyone is going through, that we continue to just get such good support from our teams to help us keep going.
Thank you. Dr. Gibson.
Yeah, thank you for having me. I think what I'd want to get across is I know that every parent out there, every grandparent, care provider, aunt, uncle, family friend, like everybody's trying to do what's best for their kids. And a lot of times there can be a lot of noise. It can be difficult to cut through all of that to know what exactly should I be doing right now to keep my kids safe, to keep them in school, to keep them kind of happy and healthy. the biggest thing is recognizing that like this is real, this is out there. The single best thing you can do, like the other physicians have said, is please get your kids vaccinated if they're able to. If you're above 5, call your doctor. We would love to get you in and get the vaccine done. It's safe, it's effective. The week it was approved, my kids were signed up that weekend at our vaccination clinic to get them there. They were very excited about their stickers. And we wouldn't be recommending it if it wasn't safe, wasn't effective. I know that parents and families want to do what's best for their kids. That's what we want to do too. If your kids are under 5 and they can't be vaccinated, there's still a lot you can do. If they're sick, keep them home. If you're exposed, make sure you watch them close. Don't still kind of keep sending them out. And so I think now's the time to kind of go back to kind of maybe if you don't need to be going places, you don't need to be doing things, maybe kind of cool off, hang home. It's cold anyway. But if you have issues that come up, if your kids are sick, if you have questions, like call us, please get seen. We would much rather take care of somebody now and kind of stop things when they're early, as opposed to kind of waiting until you're more sick or there's more complications. So just like always, if you have questions, please don't hesitate to call your pediatrician. But if able to, please get vaccinated. It's going to make a big difference kind of moving forward.
Thank you, Dr. Gibson. And we'll close with Dr. Mukherjee, and then we'll be signing off. So thank you again, everyone. But Dr. Mukherjee, take us home.
Okay, well, I appreciate the opportunity to speak. I think that being able to tell our stories is incredibly important because, there are a lot of people out there that that don't get to see this, and they don't have a glimpse of what we're seeing. And so I can understand certainly some of the difficulties that people have really realizing the gravity of this pandemic. I completely understand some of those things, but sometimes I wish I could just show people what we are seeing through our eyes every day. And so so what we're doing here, I think, is very important to be able to tell our stories. And I hope that people listen and seriously consider getting vaccinated, which is really what you can do as an individual to help your community, your families, and the healthcare in general, because that is really what we are struggling mostly is those patients who are severely ill in the ICUs, requiring high amounts of oxygen, who are unvaccinated.
Thank you, Dr. Mukherjee. And thank you all again for being with us this afternoon, and have a great rest of your afternoon.